Hi there. Thank you so much for being here. I'm so excited to talk to you guys today. Thank you to Rebecca and to Black DVM Network for inviting me to speak about this topic that is near and dear to my heart. Today, I'm going to be talking to you about my top 5 questions that I hear from mentees. This is after many years of being a mentor and having mentored countless mentees. I'll start just by letting you know a little bit about myself, how I came to be in this role as a mentor, and then I'll share with you my top questions and let you know how I answer these questions. A little bit about me. I'm Dr. Dani Rabwin. I am a veterinarian. I use she, her pronouns. I graduated from UC Davis in 2004, so this is my 20th year in practice. I have been in general practice and some emergency relief throughout my entire career. I do mostly small animal and a little bit of exotics and pocket pets. I did do an internship after veterinary school. It was a rotating small animal internship with the intention of heading directly into private practice, which is what I did. I love this profession. Throughout my 20 years, I have really maintained a lot of the joy that I had when I started out. And it's through this love of veterinary medicine and really my ability to connect with clients and with people that has led me to embracing this role as a mentor and a communication coach. I'll tell you a little bit about ReadyVetGo, which is my mentorship program that I founded for new and early career veterinarians. This is a story that started in 2020, the pandemic summer. The clinic where I was working, where I've been an associate for many years, brought on a new grad, and this was Dr. Katie. She is a 2020 graduate of UC Davis, and she occupied the desk next to me in the doctor's office, and we got to know each other very well. I was her official mentor, and because it was the pandemic and everything was curbside, we literally stayed in the office together pretty much all day, every day. And I got to hear her on the phone with her cases that she was working up. And we developed a really lovely relationship. And after a few months of working together, Dr. Katie began coming to me with questions that I knew were not her own. I knew what all of her cases were because I heard her. She was sitting in the desk right next to me. And it turns out that she was asking questions on behalf of friends and classmates who were out in private practice and not really receiving the same type of support that she was. And I said, this is silly. We don't have to have you be the go-between. Why don't we just get together on Zoom? It was the pandemic. Everyone was used to being on Zoom. So we formed an impromptu Zoom group with myself facilitating a bunch of new and early career veterinarians really all over the country. And it was quite transformative, both for myself and for these new veterinarians. And I realized that a lot of the support and mentoring that new grads need can be done remotely. Certainly, there are things that need to happen on the ground, in the clinic, in the moment, but many things, if not most things, can be talked about later. I also realized that most of the questions that new veterinarians have, although they might think they're about medicine, they're really often about something else. And we're going to jump into that as we progress through this talk. But these graduates, and for those of you new grads who are in the audience today, you know medicine. New veterinarians know medicine, probably a lot more than I do after 20 years out in practice. They know all of the new information. And what they struggle with is a lot of the other things that are the non-clinical things. How do we transition what we learn in veterinary school into a case that is attached to an owner and all of the things that come along with that owner, their values, their beliefs, their financial situation. And these are the things that I really love talking about. And so I took this inspiration from these meetings and I built out a formal remote 6-month mentorship program to help support new and early career veterinarians. And this has really grown. I work with numerous independent practices, corporate groups. We've had countless veterinarians go through our program. We now have over 14 part-time mentors who support these new grads. So we are here and available to you if you are a new grad or a practice owner or practice manager who's bringing on a new or early career associate. We are available to help complement the mentoring that is hopefully already taking place in your clinic. So before we jump into anything, I think it's really good to just talk about mentorship and why it's so important. I think there's some obvious things, like we all know that it feels really good to have someone there to ask questions and support us when we need it. Many people are able to cultivate these types of mentoring relationships on an organic basis. When I was hired 20 years ago by an independent practice owner, he really took me under his wing, taught me everything he knew. And that was a really lucky, fortunate, organic mentoring relationship that we had. But there are opportunities for mentoring to take place in a little bit more of a formal structure. And that is what a lot of the new veterinarians are requesting and expecting as they graduate from veterinary school and head into practice. So we know that there really is a veterinarian shortage problem right now in our industry. And a big contributor to that problem is turnover. So a shocking 30 to 40% of new veterinarians leave their first job within the first year, and 70% of those veterinarians leave within 5 years. This is a really high number. And many are not just going from one practice to another. Many are leaving clinical practice altogether. They're so burnt out after just 1 year in practice, they're heading to industry or sales, or sometimes leaving the veterinary profession altogether. So a big part of my mission really is to help support practices by decreasing turnover of their new associates. Mentorship is extremely important for diversity. It is no secret that this veterinary profession is lacking in diversity. The good news is that recent information that has come out from the AVMA suggests that about 25% of current veterinary students are from underrepresented backgrounds, which is good for the industry. But it means that when these veterinarians graduate vet school, they are going to have a hard time finding mentors who look like them, or who have similar experiences that they've had. And we know from studies of professional students that students from underrepresented backgrounds have a harder time establishing these organic types of mentoring relationships. And this is partly because they're less likely to ask for mentorship or feel comfortable asking for mentorship, and partly because really there are fewer potential mentors who look like them or who have had similar experiences as them. And so this results in these professionals not having the benefits of organic mentoring relationships. So this does not mean that we need to look like our mentees, or that we need to have had similar backgrounds or experiences as them. But it does mean we need to be a little bit more intentional about our mentoring, that these organic relationships that sometimes form are less likely to happen when we're talking about diversity. Psychological safety is extremely important for mentoring. We want to be able to create a safe space where our mentees know that they're allowed to make mistakes and talk about those mistakes when they happen. And so setting up formal, structured mentoring relationships can really provide for a psychologically safe space. So I know you all came here to hear my top 5 questions. So why don't we just jump right into these top 5 questions? All right, question number 1. How can I be a better mentee? So full transparency, this is not what they ask. What they ask are things like, I'm having trouble connecting with my mentor, or when I was hired, I was promised mentorship, but I'm not getting it. Or I'm in this clinic and there's all these people around, but I'm not actually sure who I'm supposed to ask for help. I feel like I'm a burden or I'm bothering people. And ultimately, I think what this comes down to is mentee skills. Often, we are not empowering our new associates to be self-directed learners and take charge of their own mentorship journey. And what ends up happening is this disconnect between what the practice or the manager or the corporate group is offering as mentorship and what the mentee is receiving. And there's often this disconnect. And so what I recommend is really empowering the mentee to take accountability for this journey, so that we can minimize some of this disconnect. You know, when new veterinarians leave their first job within the first year, often the number one reason they say they're leaving is lack of mentorship. And I don't think that this is because the clinics are not offering it. I think most clinics do offer mentorship, but mentorship looks different to different people. And if we don't establish what that looks like up front and get it in writing, there's an opportunity for there to be problems down the road. And so some of the ways that I recommend avoiding these problems are by empowering associates with mentee skills and by creating a mentorship agreement. So mentorship agreements are a document, it's a written document, which lay out agreements on both the mentor side and the mentee side. This is a two-way relationship. This is not the clinic saying, here's your mentorship agreement, here's what we're going to do, and here's what we expect from you. There really ought to be buy-in and input from both the mentor and the mentee. And ultimately, this really just needs to be written down. And this agreement is something that is a living and breathing document and really ought to be revisited and adjusted regularly as needed as the mentee is progressing on their new professional journey. So right off the bat, you know, when we talk about mentee skills and how to empower new veterinarians to take accountability for their own mentorship journey, one obvious thing is to identify a mentor. And it might be obvious, but it's not easy for a lot of new grads. And so helping our new veterinarians identify mentors, if you are a practice owner or an associate in a clinic who's been tasked with mentoring a new grad, you do not need to be the be-all, end-all for that mentee. We cannot excel in everything. And you might find that you really enjoy mentoring when it comes to medicine or surgery, but that you have a colleague or associate who might be better suited to fill in some of those gaps. Helping mentees identify who can fill different roles in their life is really important. We also want to empower mentees to establish relationship guidelines and expectations. So they should be going to their mentor and saying, you know, when do you want to meet? How often do you want to meet? Can I interrupt you throughout the day? Do you want to set up a time after work? So all of these should be discussed and written down in the mentorship agreement. We also want to establish what topics are going to be covered, what methods of communication we're going to use. Some people like text messaging, some people like a phone call, some people want to be interrupted throughout the day. And so establishing these relationship guidelines and expectations in advance can be extremely helpful to minimize some of this disconnect. And then the final role for the mentee is really what I like to call self-directed learning. And I think this is something that many of us do on a regular basis. You know, I use self-directed learning when I go to a conference and I want to come away with a couple of pearls of wisdom that I can take back and use in my clinic. We want to think about self-directed learning in terms of goal setting. So SMART goals are a great way to think about goals that one might want to have. And we want to think of short, medium, and long-term goals. And so writing down what you want to learn and how you want to learn it are the keys for self-directed learning. So I'll give you an example. I did a relief shift at an emergency clinic not that long ago. And as a general practitioner, I get a lot of referral records from the emergency clinics. And I was finding that most of my patients who were admitted to 24-hour emergency and specialty clinics were often getting methadone as part of their treatment plan. And methadone is not a drug that I was familiar with in general practice. And I decided that I really wanted to understand how and when to appropriately use methadone. So when I got to my emergency relief shift, I basically shared with the staff, like, hey, one of my goals today is to get comfortable using methadone. So that was the thing that I wanted to learn. And then the next step in the self-directed learning is, how do I want to learn it? So what I said was, if there are cases who are in the hospital right now that are receiving methadone or have throughout their stay, I'm going to look through those records. And then my goal is, if a case comes in that's appropriate for methadone use, I want to use it. And in order to make sure that I'm using it correctly, I'm going to go to the senior technician who's on the floor with me and just run my protocol by them and just say, hey, does this look right? Because this is something that I'm not familiar with, and I want to be able to utilize the expertise of all the people in the room. So this is self-directed learning. It's something that we can use throughout our entire career, and that is a skill that we can give to our mentees. And for those of you new grads listening today, it's a great habit to get into, to use throughout your entire career. All right, so my next question: how do I fit in with the team? Sometimes I might get this question directly, but there's lots of other questions that kind of fall under this umbrella. A common one is like, how do I transition from being a student to a leader? Many veterinarians work at the clinic where they might have externed or been a veterinary assistant or technician, and it's just so easy to fall into patterns of doing technician type things, placing IV catheters, unpacking boxes, when really what they ought to be doing is doctor things. But it's a hard transition, especially when we're talking about things like some generational differences that often occur. There are confidence issues that occur with moving into a new role as a veterinarian. So that transition can be really challenging, and I hear from mentees a lot about this. I also encourage my mentees to utilize the skills and wisdom and expertise of their technicians, but there's a little bit of a struggle when I hear from new grads, I'm trying to establish myself as an authority or a respectable figure in this clinic, so won't asking a technician a question undermine that role? I do get that a lot. There's also this struggle around, how do I ask for help but also get respect at the same time? And these are things that just do not come easy to a lot of new veterinarians. So this is something that I hear about a lot. I like to share with my mentees the example of my very first credentialed technician that I worked with, named Judy. She was one of those experienced technicians that I think many of us have come into contact with throughout our career. She'd been doing this for 30 years. She could do everything. And she was really an expert in dental extractions. And this was probably back in the day when technicians were doing more than they are legally allowed to do today, at least here in California. And I had a dental extraction, and I was struggling, and I was sweating bullets trying to get this tooth out. I didn't really know what I was doing, but I was so afraid of asking Judy for help. I just thought, I'm new. I was a lot younger than her. I wanted to establish myself as somebody who was confident and knew what they were doing. And I was working on this tooth for a long time. And I finally asked Judy for help, and she was so kind and so amazing. And she walked me through this case, and really the techniques that she taught me that day are things that I still use today. And I really had to humble myself, but in doing so, I think I gained respect from her as well. I remind mentees to use the experts. The same way that I said, as mentors, we do not need to be the be all end all for our mentees. The same thing goes for us as veterinarians. We don't need to know how to do everything, and we don't need to be the ones that are the experts in everything. And utilizing the skills and techniques of our staff really is a way to make them feel valued and empowered, knowing that we recognize their strengths. And in turn, it makes our life easier as veterinarians, because then we don't have to do everything. So chances are there's someone on your team who is able to really diffuse a difficult client interaction, or a technician who's great with a spicy cat or a challenging dog. And so, when we can call upon the expertise of these people, it really can let them know that we value them. And I always encourage mentees to publicly praise the strengths of their staff and to show gratitude. And this can go a long way towards building goodwill and respect. Another really important way, I think, to establish ourselves as leaders in the clinic is to share our knowledge. In addition to being a lifelong learner and using self-directed learning, new veterinarians can also be lifelong teachers. And this can start on day one in clinical practice. I find that the vast majority of veterinary staff really like to keep learning, and a lot of them get excited to have new veterinarians because they bring so much enthusiasm and all of the new information that they're learning in vet school that they can pass along to their colleagues. So I really encourage people to be curious. Talk to your team members, ask them what their backgrounds and experiences are. What are their interests? If you're in surgery with a technician who really wants to know some of the nuances of anesthesia, teach them. I think this is a really great opportunity to build rapport and connection with our teams. And it also establishes us as a person of respect in that clinic and as a leader. I love cytology. It's one of my favorite things. And I find that teaching a new skill to my team, like cytology, because that's something that I feel like I'm good at, goes a long way. So I was asking somebody to read an ear cytology for me in clinic. This was a few years ago. And the person who used to do it or regularly read the cytologies was not there that day. And I started to look at the cytology myself, and I just thought, this is really silly. We should not just have like one technician who reads these slides. We really need to have more people who can do this. And so what I did that day is I just put a sign up in the treatment sheet, and I said, I will be giving a 10-minute quick little mini lecture on cytology for skin and ears at noon, which is when I had a break during the day. And I said, if you want to come. And I printed a bunch of pictures and created a little notebook, and everyone showed up. We just sort of took a pause for that day. I did a quick little 10-minute lesson. I had everything in a nice little binder, which was our cytology book. And the less experienced staff, I'll tell you, they loved learning a new skill. And it really benefited me because, it takes time for us to read a cytology. It might seem like a small thing, but if you're doing multiples of these every single day, it takes away our time. And by teaching a skill like this, it really empowers the team to progress in their own knowledge and feel like they're helping you, which is ultimately what they're there for. I personally am not good at bandaging, but this is another area that I think doing a little mini wet lab in the middle of the day on bandaging, if that's something you're good at, I'm sure you can think of something that you love and enjoy that you can do a training on, which is a great way to build connection among the team and to become a leader in the practice. And this might seem like a small, simple thing, but this is a big deal. So learn everyone's name, do small things like buying coffee, bonus points for finding out what people's favorite coffee is and bringing something specific for each person. I already mentioned public gratitude, but I think this is extremely important, and showing humility, really being somebody who can create a psychologically safe space and be open and honest when you have made a mistake or if you overlooked something, and sharing that publicly as well to make your team feel like they can come to you when they also have made a mistake or need to chat about something important. All right, this is probably the next thing that I hear the most about is establishing trust. So why don't my clients trust me? This question can come in many different forms. We might hear from our mentees that my clients are always asking me if I'm old enough to be a vet. How do I deal with that? How do I improve my confidence? I think this is directly related to client trust. Imposter syndrome is something that many new veterinarians, many experienced veterinarians deal with imposter syndrome. And so all of these really are, I think, related to this idea around trust. If we are confident, then we really can feel like we're building good rapport and trust with our client interactions. and we'll be able to build more trust and move forward with our recommended treatment plan. So this photo here is my very first mentor. This is Buff. This is Dr. Mike Buffum, and he was the person who hired me after my internship. And Buff used to do this thing that I found to be incredibly annoying. He would, when I was in my exam rooms, he would, let me pause. Let me just say, Buff owned his clinic for like 30 years before I came in. And he was a solo practitioner, and it was a small town, and he knew everyone. And he put his blood, sweat, and tears into this clinic, and bringing me on was a very big deal. So he would come into my exam rooms periodically when I was new, and he would say, Dr. Rabwin, come with me. And he would take me out of the room, and he would bring me into his exam room with a client that he was seeing. And he would say, Mrs. Smith, this is Dr. Rabwin. She just graduated. She's young and she's new, which means she knows all of the new information. She's a much better new doctor than I was. I trust her completely. And when I'm not here, if you need to come in, Fluffy will be in really good hands. Okay, Dani, now you can go back to your room. And it was so embarrassing. And at the time, I really did not recognize it for what it was. But later I came to recognize it as an extremely valuable gift that he gave to me. He really elevated me in the eyes of his longtime clients and let them know that he trusted me, and therefore they could trust me. And I remind mentors and practice managers and team members to do this as often as you can with your new associates. And if you are a new grad, you can ask your team to do this for you. You can ask the practice owner to introduce you to some of their longtime clients. This might not be something that a lot of people think of, but this is really, really important. And it's a very powerful way to boost confidence and to help instill trust in clients. These are my three sort of pillars of trust building for client interactions. The first one is curiosity. I really lead with curiosity in so many areas in my life, but this is an especially important one. Active listening. We really want to be good active listeners with our clients and being empathetic. Nowhere in here am I saying we need to have all of the answers, or we need to know when we're in the exam room exactly how we're going to recommend treating a case. That is not what trust building is about. Trust building is about making the client feel seen and heard and listened to, and these are some of the ways that we can do it. So when we talk about curiosity, and when I let new veterinarians know that they will be able to build more trust with their clients through curiosity, sometimes I'm asked, won't people think I'm nosy? And what we know from studies, especially on the human side, is that when their physicians approach them with coming from a place of curiosity, it's perceived as friendly and not intrusive. And curiosity can elicit a warm response. It can soften the mood. It can definitely improve trust. And once there's trust, there's better patient outcomes. So we can use curiosity for so many things. If our clients come in and they're really tense and their arms are crossed and they're might seem like they're a little bit angry, I usually say, let's sit down, let's get on their level, let's soften our tone, and let's say something like, this seems like it's really hard for you, or it seems like you're really worried about Fluffy. Can you tell me what's going on? So approaching things from a place of curiosity can really soften the mood and open the door for connection, which ultimately can lead to more buy-in for our recommended treatment plans and better patient outcomes, which is what we're all here for. Active listening can look like so many things, but sitting down if the client is sitting, getting on their level, standing if they're standing, tone matching. So speaking a little bit more quietly if we have a client who's a little bit more soft-spoken, eye contact, nodding our heads, repeating back what we've heard, reflective listening. So if I heard you correctly, what you are saying is, and using language like that feels authentic to us, but that lets the client know we are really listening. Again, just the 3 pillars for trust building: curiosity, active listening, and empathy. I encourage people to come up with phrases that feel authentic to them. So these are some of the examples of phrases that I use. When I'm speaking about curiosity, I'll say, just tell me what is happening. What's going on? Active listening is reflecting back, saying things like, so it sounds like, or what I've heard is, and being empathetic. Veterinarians by nature, we are deeply empathetic people. However, I feel like sometimes we are not as good at expressing our empathy as we are really at feeling it. And so practicing using empathetic language can be very helpful, and saying things just like, I completely understand why you would feel that way. That's a really powerful thing that can go a long way towards building trust. All of this is part of a topic that I practice regularly. It's a way of connecting with clients, which is called shared decision making. It's a whole other way of communicating that we could go into in another talk. But really, the hallmark are these 3 trust building exercises. And what it allows us to do is move away from kind of this old school way of doctor knows best to making recommendations based on consideration of the client's values and beliefs, while also being informed of evidence-based medicine. And when we use this tool of shared decision-making, we're really letting go of attachment to outcomes, not being attached to our clients choosing a treatment plan that we might choose for our own pets, but really taking into consideration their values and beliefs. And you're going to know about these by using curiosity and trust building exercises. All right. The next thing that I hear a lot about is really time management. This is such a big topic. How do I get home on time? I hear frequently from veterinarians that they are stuck in the clinic late at night. They might be bringing work home with them. They might be in exam rooms that are just going on and on and on. They might get on the phone to deliver lab results and be stuck on the phone. And they might feel like they're not being able to have enough time for themselves or their family. So these are all under the umbrella of time management, which is something that many of us veterinarians have trouble with, but especially new grads. And so these are kind of the 4 things that I think are just so important for time management. And delegation kind of falls under the umbrella of leadership. It's hard for veterinarians as they transition into this leadership role to delegate. They're probably used to doing everything themselves, or were a technician where they had to do everything. And so being able to delegate is extremely important. Automation can be very helpful. There's lots of ways we can automate. I encourage new veterinarians to just find little pockets of time. 5 minutes is a long time to fire off some emails, giving some quick lab results, or to sign the dreaded prescription refills that we're frequently having to sign throughout the day. And so taking advantage of pockets of time can be extremely helpful. So we're going to dive deep into just a couple of these. Delegation, really, veterinarians should be diagnosing, treating, prescribing, and performing surgery. That's it. Those are the 4 things that we should be doing. If there's a task at hand that does not fall under one of these 4 categories, it should be delegated. So this could be things like following up with lab results, sending emails, checking voicemail, doing things like cytology, placing IV catheters. These are not things that veterinarians ought to be doing. These should be delegated. And so helping vets know who they can delegate things to can be extremely helpful. So empowering them to delegate tasks. Exam room efficiency, there are skills and tips and tricks. I'm sure you experienced veterinarians can give many tips that you have learned over the years to some of the newer veterinarians that are watching this or that you're working with in the clinics. I usually remind people to focus on the presenting complaint. If a client comes in and they want you to check a lump that they feel, and you spend the entire appointment time talking about the dental disease or the heart murmur that you've just heard, this, number one, it can decrease the trust that the client has in you, but it can also make an appointment go on and on and on. If you do find dental disease or a heart murmur in a dog who came in for a check lump appointment, those things should be addressed. But I recommend remaining or leading with talking about the mass first. That's what they came in for, so that they know you're really paying attention to why they're there, and then talking about those other things. Because if you don't, then you end up spending longer going back and talking about the thing that the client brought the pet in for. So focusing on the presenting complaint. I always like to ask my clients up front, how much information do they want? Some clients don't want a lot of information. They just want you to tell them bullet points. They don't want to know all about pathophysiology and disease processes. They want you just to get to the point. They might need to do carpool for their kids. And so I think, asking in advance, like how much information people want, is a way to build trust. And it's also a time management technique, because you will find that you can get through your appointments more quickly if you know how much information a client wants. If a client says, I like to know all of the minutia of this disease, then you might say, I'm so glad that you want to be such an active participant in this decision or in Fluffy's healthcare. Due to the limitation on the amount of time I have for each appointment, is it okay with you if I follow up with an email? I have a website with some resources that I would love to send to you. Or you might have already collected a library of follow-up handouts that you can email. Or, I take my laptop into the exam room with my clients and I'll just send them something right when I'm in the room. I'll say, I really understand that you want more detail about this disease, but I do have another room waiting. I'm going to click this button right here. Okay, I'm sending you this information. This way you can read in more detail. And if you have more questions, we can set up a follow-up appointment or a recheck phone call. Automation, there's so many different ways, especially with all of the new technology that we have. There's a lot of AI now for soaps. There's apps, you can dictate things into your phone. A lot of handouts and follow-ups can be automated, like templates and go homes. All of those things are available to you. A lot of the practice management software has some of these things already embedded. There's lots of resources that you can use with pre-made templates. And you, as a new grad or a clinic, can come up with some templates that you all agree on would be helpful to give as handouts. I also recommend using a timer. I put this in automation because I think it kind of falls broadly into that category, but setting a timer for yourself. If you're a new veterinarian who's struggling to get in and out of exam rooms, if you have a 30-minute appointment time, I recommend 10 minutes of that time really ought to be spent in the exam room, and you can get to a 10-minute appointment. And so perhaps that means that you set a timer and bring it in with you, or leave it outside the door so that it beeps at around 7 or 8 minutes to remind you, hey, it's time to start wrapping it up. That way you can do your 10, 12 minutes in the room, step out. As a new grad, we need time to look things up. So there's built-in time to look things up for how to come up with your treatment plan for that case, and then 10 minutes to complete your soap. So ultimately, everything can be done and your record written within a 30-minute time period, or whatever your appointment schedule is. All right, this is something that I hear about a lot. Inevitably, any mentee I work with, this is something that they struggle with. I think we teach a lot about quality of life and euthanasia in the vet schools, but it is not the same as when you are out and you are the doctor on the case. So navigating quality of life discussions is a challenge. This can come in many different questions. I hear sometimes about struggles that new grads have with convenience euthanasias. I think it's really interesting to have a conversation around the definition of convenience euthanasia, because that really can vary. Sometimes new grads struggle with disagreeing with a client's decision around quality of life for euthanasia, either doing it too soon or too late. So those are things that people struggle with. One thing that I hear about a lot is if a pet owner has not brought up quality of life or euthanasia, but the veterinarian thinks it should be brought up, that can be very awkward and uncomfortable. They're not sure when it's appropriate to bring up quality of life and euthanasia. And so there's so many different questions that fall under this category. It might seem interesting that I'm recommending to know your why when talking about quality of life and euthanasia, but I think it's really important because sometimes as veterinarians, we forget why we went into this profession in the first place. And our why is going to vary from person to person. It's also going to vary throughout our careers. But understanding why you're doing what you're doing is a really nice way to help you navigate the challenges and the highs and the lows that are associated with some of the emotional roller coaster, honestly, that we can be dealing with as veterinarians. I also think it's really important to understand our biases. You know, clients often are going to make decisions that differ from our own, and that is okay. What really hurts me is when veterinarians go home at night laying awake because they're questioning a client's decision or feeling like they weren't a good veterinarian because their client didn't choose what they would have chosen for themselves. And I think this is a recipe for burnout. If we are attached to the outcomes of every case that we deal with, we are going to get tired quickly. And a lot of the decisions that people make have to do with their own cultural values, beliefs, experiences, and being aware of our own biases can really help us understand where our clients are coming from. We might differ from the way a colleague manages a case. We might have a hard time responding when a staff member questions our own decisions. And all of these are have the potential to cause us to be defeated and get frustrated. And, you know, really being aware of our biases can help us get through these common interactions that we might have with clients and staff and colleagues, and will help us maintain our love for this career. And really, you know, kind of having this self-awareness will really influence the way we navigate these conversations and really common interactions. So ultimately, you know, what I like to remind mentors, and I know that there's a number of mentors who are listening to this talk, is really get at the heart of what is your mentee really asking you? And, you know, this has to do again with our own biases. You know, we might be triggered by the way a mentee comes to us with a question, but really trying to figure out what are they really asking? And then using the tools that we talked about in this talk, approaching things from a place of curiosity. Where is this coming from? See if we can really get down to the heart of what our mentees are asking us. And then I just like to remind you as mentors and mentees that this job is fun. And I don't want people to lose sight of that. You know, the fact that we get to do what we do every single day is a joy and a privilege and can be extremely fun. And as new veterinarians, with the learning curve being so steep, and with us as veterinary professionals often being very type A and focusing easily on our mistakes more than our wins, we lose sight of the fact that we are really helping people and pets every single day. And this job has the potential to be really, really fun. So I hope you were able to take away some tips. I am available to any of you for questions. I really welcome questions. You can reach out to me at any time. I'm going to put my contact information up here in a moment. I want to remind you that we are currently enrolling for our July mentorship cohort. If you are watching this on demand down the road and July 2024 has passed, we do have at least 3 cohorts per year. So you can scan this QR. You can also go to readyvetgo.co to get more information about our mentorship cohorts. If you are a practice owner or manager and are bringing on new associates this summer who are just graduating or are early career veterinarians, we would love to welcome them into our program. We have a free preview course using this QR as well. And we have a free community. The community is really fun. This is for all of you. This is open to all veterinary professionals. This is a private networking community for networking and asking questions of mentors and mentees. We have race-approved live and on-demand webinars each month. We have drop-in Ask a Mentor Anything that are really, really fun. So many things for you to take advantage of in the free community. Here's my contact information. Reach out to me at any time. Please note it is .co, not .com. We are very active on social with tips and tricks for mentors and mentees, and so we would love for you to follow us. And I will welcome any of your questions. And I'm so grateful for your attention and your participation and for showing up for this webinar. Thank you so much.